much indeed. Welcome back. Now on our sofa is cosmetic surgeon Jonquille. Now, she's brought along her patient Glynis here for a state-of-the-art non-surgical facelift. And it just goes to show how things have moved along when I tell you this facelift will be carried out here today in front of this studio audience. Jonquille, I'll start with you. I was talking to Jonty earlier, just in layman's terms. We've heard of Botox, I've heard of Botox, I've even heard of fillers. Yes. This is a facelift, non-surgical. Explain what you're going to do today. A fluid facelift.
This is going to be over a couple of procedures, so this will be the first stage of Glynis's treatment. And it's going to be using things like what you've heard before, dermal filler, just to lift and give volume to the mid part of the face, which is where all the ageing comes from. So that will give it lift, and then I'll be able to support the lower part of the face with the same products, basically. Would
it be, in layman's terms, the injection of fluid into the face to lift the face and rid the face of lines? What is the difference between that and, say, Botox?
Botulinum toxin is a muscle relaxant, so you inject it straight into the muscle, and over a couple of weeks it relaxes the muscles so that it smoothens out the lines directly.
Why would people come to you for this procedure? Is it cosmetic? Are there a whole variety of reasons? What is it?
There's a huge variety of reasons. A lot of people think that it's literally just, you know, beauty, vanity, that causes, you know, them to present to us, but actually most people have concerns about their face or their bodies.
I'll say here now, Jonty, I think this is absolutely anybody's right to make this decision, and these developments will continue at a pace. Have you had people in your surgery saying they want cosmetic surgery?
Yeah, absolutely. I mean, I think increasingly people are aware of that, and actually the emotional and the psychological impact very often on people is significant. So I think as long as, I guess, we always bear that in mind, and we always try to make sure that this sort of surgery, we're not necessarily just encouraging vanity, but we are seriously looking at people and their underlying concern.
Let's go and see Jonquille if we can. Glynis, your patient here today, and I'll leave this to you. I'm enthralled. Let's find out as much as we can. All right.
Okay, so Glynis came to see me in the clinic. She's a lady who has a beautiful face and has fantastic bone structure. She doesn't want anything drastic. She just wants a little bit of freshening up because she feels that she's looking quite tired now. So she doesn't want any drastic surgery. So what I'm planning on doing is, she has these wonderful cheekbones which will allow her to preserve her ageing process for a very long time. I'm just going to put a little bit of volume back through here. Now this is where the second place in the face where you lose volume from and starts the ageing process. So that's when you get this parallel line through here, and then you start to get a jowl. So if I go like this, you can actually see that that's starting to look a little bit heavier. So we'll pop some temporary filler through here, through there, and to support that through there.
How do you feel about this process, briefly?
I said I won't have anything done until I'm 50, and then I'm just approaching 55, and I thought, no, got to start doing something.
You look good for 55.
Now. Just a little, you know, freshening up, and I know it will make me feel better.
That's the point. Listen, you start. We'll stand and watch.
So the skin's already been fully cleansed. This product has anaesthetic in it, so Glynis may feel just the first initial injection, but after that, it'll be very comfortable.
Now I'll hold your hand.
Okay.
Okay.
I knew you would in the long run.
I've got one.
You just relax fully for me. I promised. And just relax fully for me, Miss. That's it. Okay, so you feel a scratch now. Well done. So this isn't to give her any hamster cheeks or anything like that. This is just to preserve this little fat pad that she's lost in the skin.
Thank you.
I'm squeezing your hand really tight there. It's quite right.
You're right. It's just the initial tiny.
You can't really feel anything uncomfortable.
Can you feel fluid going into your face at all?
No, I can feel like a pin pressure.
So this line that I'm going to be treating now is, in layman's terms, the nose to mouth line. It's called the nasolabial line.
Okay.
Okay, you'll feel a scratch now. Well done.
And a lot of people have fillers for those lines, don't they?
Yeah. It's very common. But you have to remember the cause of the line. If you just keep filling this, you will...
I'm looking at their faces and looking worried.
There's one or two squeamish people, I suspect, but that's sort of understandable as well, I think.
Okay, so that should start to go numb now. And then you'll feel the scratch. I don't know if you can see the skin actually visibly lifting through there.
What are you doing now?
This just helps to manipulate it into the right place and just make sure that it's nice and smooth and consistent.
Can anybody in the audience at this point see a difference on this side of the face? Can you see a difference? Yeah. Yeah? Yeah, no, you can. Absolutely you can. That line is much less here than there.
Glynis doesn't have a huge amount to correct, so it's...
She looks amazing anyway.
Exactly.
Oh.
So you're not going to see a huge difference, but it's just about correcting a few little contours.
OK, what we're going to do is we're going to leave it there, Jonquille, because I know this is a process you're going to continue.
Yes.
And we will catch up later. Thank you very much indeed.
Thank you.
Thank you. You all right?
Yes.
What I want to do now is just catch... Jonquille, say how this procedure's going with Glynis. Bit of an update. We've moved across to the other side of the face. How's it going?
We have. I'm just finishing supporting the corners of the mouth.
Yes.
That's often one of the first...
Can we put that back on? Oh, there we go.
see.
That's good. We can see again. You look about 25 to me, love. It's going very well. How are you feeling?
Feeling like I've been to the dentist.
Do you? It's interesting.
It's a little bit numb.
I have to say, and I didn't... you can see a difference. You can see a big difference. Can't you guys, on the screen? You can. Yeah? You can see a big difference, can't you guys? Actually, there is a huge difference there, certainly with those lines that you said and around the mouth. And that hasn't been a particularly long procedure. That's very interesting.
You can see that this is now straight.
Yes,
This
absolutely.
is now lifted through here.
Yeah.
And by giving that lift, it takes off the gravity effect from here.
I don't know what you guys think here and at home. I think it's fascinating and it's very interesting. I've been really impressed with it, and I appreciate your time today, Jonquille. Good luck. Give him a round of applause, though, gentlemen. Fantastic.